figure out how you move right now, but before I do that, can you show me where you're feeling the pain now I'm looking at your spine?
Right around there.
You feel it there? Wow, that's kind of low down. Is that where you always feel it?
Yeah, pretty much. It's like right around there.
Okay. That's not even your spine anymore. Okay, so it's always been over here, and more so on the left side over here?
Yeah.
Okay. So then I have a couple more questions then. So when it goes down into your leg and you feel that, you said ants in your leg or something?
Something like that, yeah.
Okay. What do you feel and where do you feel it?
It just, I guess it goes from like right here to my feet.
So it's in the front of your leg, right?
It's almost the entire leg, I would say.
Oh, it's in front. Okay.
And then I would like rotate my leg to kind of alleviate it or move into a certain position, and sometimes it helps and sometimes it doesn't.
What positions actually make the ants come a little bit worse? Is it sitting in the car or?
I would say lying down on my back.
Lying down on your back?
Yeah.
Okay. Interesting. Okay. And you feel it all the way from here to your whole foot?
Yeah.
And it feels like ants crawling or?
Sort of like, yeah.
Okay. How long have you been feeling that? Because I know this has been going on, but how long have you been feeling that?
I would say about a year and a half ago.
But this you've been feeling for a long time?
Yes.
Even before?
Yeah.
Well, how long have you been feeling this?
I would say maybe 10 years.
That's a long time. And what positions hurt this?
Various positions. There's not one position that makes it hurt. I think it's just when it wants to hurt, it hurts.
When it wants to hurt? Okay. And so try to just walk normally. Okay. So left foot is twisted inwards and his right foot is twisted out. Let's have you come on back. Yep. You have a bigger bunion on this side than you do on this side too.
Mm-hmm.
So your whole pelvis is twisted, like this foot is going this way and this one is going this way. I'm exaggerating, of course, yeah, but that's essentially why you're feeling you have more bunion formation on this side. Do you ever get knee problems on this side too?
I think once I had a knee problem, but no, not recently.
Okay.
I noticed this joint right over here hurts a lot.
Yeah. Yeah, so the reason why that hurts more is because when you're twisted in like this, I mean, you could just see it, but if I did that to my own pelvis, this whole leg twisted in, like your pelvis is rotated like that, I showed you. But if it does that, it twists your knee, and it makes this what's called pronation here. And so it pronates inwards, and it twists that bunion out like that. That's why you see it way more. That's a lot more. Yeah, you've had this for a long, long time. That left pelvis is... looks like he's swaying off to that side. And you said this position starts the ants crawling into your leg?
More so at night after I've been walking for like a long time.
Okay. Just relaxing here. Does that bother you?
Just the stretching part, yeah. I don't stretch much.
And the stretching pain's worse when
Yeah.
So that's not a stretch, that's your nerve. Because if I do that, even worse into there. Yeah. So that's your sciatic nerve that goes down into there. And the sciatic nerve is like right there. That's where you feel it too, right? Back into there? Yeah. Your nerves are tight into there. So your pelvis is twisted, you have nerve issues, but you're feeling pain kind of far down here. Okay. And then how's the rest of your body?
I would say the past month and a half there's been a pain like right over
Between your shoulder blades?
Yeah, but it's only when I kinda do that. Well, actually more like right here.
Okay. When you look back?
Yeah.
So look back one more time. That's all you can do? And it hurts?
Yeah.
So can you turn your head? I'm going to see if there's symmetry in how you turn your head. So go ahead and turn your head to the right. That's all you can turn? Okay. Does that bother you?
No.
Okay. And the other side? You can turn easier to that side. Do the right side again. You have a lot less motion going to this side than the other side. You know that, right?
Yeah.
Look to that side again. Look at that.
Yeah.
And then do that way. That's significantly less. Obviously, the right shoulder is higher than the left shoulder. It could be contributing to why he's having trouble rotating his head. But then if we look over here, there's some sort of swelling that's going on over here too. It should look more like deep, but there's some sort of like formation, that peel, orange peel effect. Okay. Something there. There too. Okay. Okay. But you feel it mostly down here, right?
Yeah.
A little painful here too, right? A little bit here.
Just a little.
Tilt your head back again. That's when it starts hurting.
More. Right there.
Okay. This is even further down than your actual, your lumbar spine.
Mm-hmm.
This is actually your sacrum. So if we poke here and go a little bit over here from the ST level, that's where you feel it? Like through here?
Slightly lower, actually.
Oh, over here?
Yeah.
Interesting. That's pretty low down. Okay, so this is your S3. So do you feel tender here?
No, it's more, right there.
Right there, okay. This looks like we're going to have to adjust the S3. So there's a slight wedge over here. If we look at the contour of that, we can definitely see there's this open wedge over there. So that's S2, which I would argue is also wedged. But S3 is as well. These bones should actually all fan out like this, right? And then when you come back, they should all close together, right? And so, what do you notice is not closing if you go back? All these are closing, right? But then do you see these closing at all?
No.
No. Yeah, so that's where it's jamming into there. Yeah, so we will need to actually adjust that. So what I'm going to be doing is I'm going to be adjusting T1, okay? So that's the one that we saw wasn't moving, but also if you look over here, it's actually twisted too, right? And so what we're going to do is actually push that in like that, okay? So I'll show you. Okay, so just relax a little bit. Good. Not too bad, right?
Yeah, not too bad.
Look to your right. Get that? Okay. Better?
Yeah.
Yeah, you can move more. Go to the left again. Okay, and then the right. Way more symmetrical, right? Different?
Yeah. I mean, there's a slight pain, but not as much as before, and I can go farther.
Okay, good. So, that's step one, right? So, step two is over here. So this is your, what's called your S3, okay? So we're going to use, I'm going to show you what I'm going to do, okay? So I'm going to roll you a little bit to me, okay? I'm going to give this a little push in, okay? So I just need you to relax, and we're going to use my fingertips. Good. So we're adjusting the S3, but more so on the left side. So let's relax you a little bit more. Good. Not too bad, right?
Yeah, not too bad.
Okay, come on up. So what can happen is the joint can catch over there. It's not really catching into there. You should know by next time how if it changed at all, right?
Just from you pressing there, it's not as sore as before.
Yeah, I mean, we got some good motion into there, and we adjusted that joint very specifically. And that joint is actually something that's usually kind of fused together, so we want to make sure we're very accurate with the way we adjust that. So it should feel better, like through there. But I want to make sure also in your daily activities it's feeling better too. I don't want it to be in your head, so you'll let me know next time.
Okay, yeah.
Yeah. But other than that, those are pretty much what to expect each time. So every single time you come in here, you know, like I told you, we're always going to be staring at this, right? We'll be staring at your x-rays, but we'll also be measuring every single time. Make sure that we're on the right track, making sure we're making some sort of positive change.
Yeah.
Still better? Yeah, yeah. So
there's just some slight discomfort, but it is better than before.
Yeah, and it should get better and better through the weekend. Yeah, okay. So this is where we want you functioning better. We want to be measuring these things. We want to know what's been changing and just keep making progress, right? Because imagine with one adjustment, what we can do with that. But if we can really fix all these things that are going on over here, that'll make a huge difference for you. Okay. Yeah, just don't do anything really strenuous, like for the first couple of weeks while we see you.
Mm-hmm. Okay,
have a good one. Yeah.